Welcome to the Health Exchange with Leon Bibb.
Good morning, everyone, and thank you for joining us for another edition of the Health Exchange. This morning, we will discuss something each of you should be concerned with, and I'm talking about your skin, very important to all of us. Before you head out for the beach or outdoors for that well-deserved vacation, think about this. The sun you soak up can make you look old before your time, and the sun can produce enough of a chemical reaction in your skin to be toxic to your health. In fact, though it appears tough, the skin you're in is vulnerable, and more so than you may think. Let me introduce you to our guests now. Our guests this morning, each a dermatologist from university hospitals. We would like to say good morning to Dr. William Lynch, who specializes in skin cancer and performs cancer surgery, and Dr. Robert Haber, who specializes in pediatric dermatology and in cosmetic dermatology. By the way, this includes hair replacement surgery. Thank you, gentlemen, both for joining us. Does all of this come because of the effects of the sun?
Almost all skin cancers are directly or indirectly related to the sun exposure. Basal cell cancers and squamous cell carcinomas are certainly related to sun. Malignant melanomas are less clearly related to the sun, but also probably related to sun exposure. So it's pretty clear that long-term sun exposure is a very significant risk factor.
You know, when somebody sees this kind of a spot on their skin, how do they know if this is a danger spot? Well, certainly you want to check with your doctor, but are there little indications that we can have very early?
Well, the simplest thing to look for is any change. So any mole that you've had that is changing, or any spot on your skin that's new, is certainly cause for concern, and is something that you want to bring to the attention of a dermatologist. We have certain types of things that we in particular look for. We call them the ABCDs. So any mole that's asymmetrical, any mole that has an irregular border, has multiple colors, is C, and that's about larger than the size of a pencil eraser. Mm-hmm. These would all be moles that would really benefit from being seen by a dermatologist.
Okay. We've all heard about the premature aging of skin. What really happens when they say you look older before your time?
You can easily tell the difference between what the sun is doing to your body and what natural aging has by looking at a part of your body that you haven't sunbathed. And the difference is fairly dramatic, and it's almost wrinkle-free even in a very elderly person. So these changes are pretty much all due to the sun.
Old man sun can make us all look old before our time, I suppose. Let's take call number, you're on line number 2, you're on the Health Exchange. Good morning.
Good morning.
What's your question?
I have a bad sunburn I got yesterday. My question is, should I see a healthcare professional every time I get a sunburn? Am I at risk automatically because I've gotten a sunburn?
Well, the risks for sunburn are long-term. We know that people that get skin cancers do have a history of severe and frequent sunburns early in life. So the first thing we'd recommend is to make sure you use sunscreen and protect yourself to prevent the burns. I don't know how old you are, but if you've had lots of burns when you were much younger in childhood, then your risk is just increasing with each burn. The burn itself is like any other, most sunburns are generally a mild first-degree sunburn, and you can just treat it with aspirin or Tylenol for the pain and try to protect it with soothing compresses. You don't need to run out and see a dermatologist. You're not going to get a skin cancer next week or tomorrow. But your risk is really long-term, so it's very important to protect your skin and prevent those burns.
Good morning, you're on the line.
Yes, sir. I have a serious problem with melasma, and I'd like to know if there's any treatment for that.
With melasma, did you say?
Yes.
Well, melasma, which is pigmentation on the cheeks and sometimes other parts of the face, is not an uncommon problem. It's not an easy problem to fix. Melasma is sometimes made worse or precipitated with pregnancy or birth control pills, and sometimes just happens with age and a genetic tendency. There are some treatments. The treatments would generally consist of either chemical peels or some topical fading creams combined with retinoids. Treatment is variable, so really depending on your particular situation and what you look like, there certainly would be some treatments. How effective they would be dependent upon what's causing your melasma and how severe it is.
Thank you. Dr. Haber, I know one of your specialists is pediatric dermatology. What about the children?
Well, of course, Leon, children don't get a lot of skin cancer. However, the pediatric age group is the most important time to protect the skin because we know that, again, the most significant exposure time is during childhood. That's when the significant burns are going to occur that's what's going to put a person at risk perhaps several decades later, but that doesn't mean that we should be careless in childhood. So before the age of 6 months, no sunscreens are considered safe for babies. Simple protection, using of an umbrella, keeping them out of the sun. After 6 months, using an SPF factor of a minimum of 15, waterproof, applied liberally at least 20 minutes before going out in the sun. I tell my patients, apply the sunscreen at home when there's no sand and no interruptions and no distractions. By the time you get to the pool or the beach, the sunscreen will have had its time to work in its maximal way, and the child will be well protected. Apply it at least one more time during the day after lunch, and you'll be doing the best thing you can for your children.
We'll take a phone call. Good morning. You're on the Health Exchange.
I always use sunblock and everything, and I don't get a sunburn, but my skin is peeling a lot everywhere, and I want to know what I should put on it. My skin is really sensitive. I just use glycerin. But is there any way I can stop the peeling or help it?
Well, it's hard to say exactly why you're peeling. If you do use your sunscreens diligently and appropriately and have avoided a burn, most people that peel after the sun are peeling because they had a burn. If you're peeling and you didn't have a burn, you might simply be having some very dry skin. And for that, we'd recommend any of a number of good, strong moisturizers.
Good morning. You're on the Health Exchange.
Yes, I'm 65 years old. One afternoon, my arms were exposed to the sun. The following morning, I noticed quite a few white bleach spots. Is that anything of concern, and why so? Thank you.
I missed part of the question. Some white spots on the skin?
She said white bleached spots, and she's gone right now, unfortunately. White bleached spots was what she said.
Well, again, that's kind of tough. Some things we can't tell about unless we, of course, see it. Long-term sun exposure will cause a variety of pigment changes. It can cause inflammation, which can result in dark spots or light spots on the skin. If immediately after sun exposure we have some light spots, that could represent some other type of infection on the skin where some parts of the skin are tanning and other parts of the skin are not tanning. But to be certain, we'd have to see that patient.
We'll take another call. Good morning. You're on the Health Exchange.
Oh, thank you for getting my call. My question is about facial hair and the effect of electrolysis. And recently I heard something about an electronic kind of treatment to remove the hair. Could you please address these questions?
Okay.
Well, electrolysis, there are a variety of techniques to remove hair from any part of the body where it's not desired. And electrolysis is, I'm not sure exactly what you're referring to, because electrolysis is an electronic means of removing the hair using a very mild electric current to destroy the hair root itself, and then the hair comes out. Electrolysis is considered fairly effective. There are some newer techniques, but they all operate in the same general principles. They're just using a variety of different approaches.
As we wrap things up this morning, we'll ask our guests if you've got any late advice, last-minute advice. Dr. Haber?
Well, it's never too early to start good, safe skin protective measures. And what we'd like to recommend is starting very early in childhood. Get your children in the habit of wearing sunscreen and finding shady activities for the middle part of the day. And if your children have a lot of moles, at least once early in their life, bring them into a dermatologist, let someone take a look at them, make sure that we don't have anything that's significant showing up.
And down at the last 10 seconds, it is the accumulative effect of the sun which can create problems over the years.
Definitely.
Yes, skin never forgets.
Okay. Well, that will do it for us for this morning. Let me say thank you to our guests, Dr. William Lynch and Dr. Robert Haber, both of University Hospitals, both dermatologists. Next week, we discuss infertility. I'm Leon Bibb. The doctor is in.